One thing that is becoming more clear with autism is the fact that human brain development is not linear, and so is language development. As a pediatrician, we're trained that when you're assessing for speech and language development, the first thing you have to ask your parent is, does your child have any words? Like, can they say baba? Can they say dada? They say kaka? And that as the child progresses, you expect them to keep on adding words into these nouns. And so when a child gets to 2 years, you ask them, can they be able to make 2 word sentences? And then to 3 years, 3 word sentences, like that. And that is only one type of language development. Now, for our children on the spectrum, they really don't necessarily follow that pattern. That pattern is called analytical language development. They follow what we call Gestalt language development. Now, what is that? That means these children learn language from phrases. So they will not start by saying baba, dada, or kaka. They'll start saying phrases like, why are you doing this? Or I love you, or I need help. Because for them, language comes in phrases, and it's from these phrases now they keep on trimming them to a point where they're able to get one noun or one verb and use these nouns and verbs to form their flexible grammar, which is what they're eventually going to be used in their communication. Okay, so you've come to realize it's exactly the opposite of the analytical language development. So children who experience Gestalt language development, usually most of the time they also have echolalia, and that's what we are going to talk about in this video today. Echolalia simply means echoing back the speech or the language that they've just heard. And echolalia can either be immediate or delayed. Immediate is when you ask a child, what is your name? And then they repeat, what is your name? And delayed will mean they heard a phrase 1 hour ago to 1 year, 3 years, 5 years ago. Okay, this is very important for a child who's on Gestalt language development, because it is through the different phrases they're going to pick along the way that they are going to be able to segment them based on their language development. Eventually, they are going to end up with different nouns, different verbs, different adjectives, and this is what they are going to really use in their grammar. It can be tempting to always try to stop your child from being echolalic, but sometimes you may need to chill and you really want to watch that till the end of this video. So for children on the spectrum, there's something specifically called situational gestalt. And this is specifically for children on the spectrum because for them, they're able to really recall that phrase and experience the same environment they experienced when that phrase was being spoken. So things like sights, sounds, smells, sensations, feelings that came with that particular phrase. So you find when your child is being echolalic, it's because they're experiencing that. Maybe they said something or they're feeling something or they've seen something and it reminds them to that particular situation. And that's why it's not very wise to just want to stop your child from being echolalic, because for them, whenever they're saying that phrase, it's a whole experience. So what do you do when you have your child who's echolalic? The first step is you need to understand why are they echolalic, because echolalia means different things for different people. So the first question you really need to ask yourself is, why are they using that particular phrase? Because echolalia can be used as part of their communication. As we said, it's part of their language development. It's a way they say yes. For example, when maybe somebody was giving them an apple or a glass of water and they said, do you want water? Now, because they don't know to say yes yet, they are going to repeat, do you want water? To mean they want water. And anytime they're going to need water, they will not tell you, I want water, unless you're going to train them. But they'll come to you and they say, do you want water? Okay, so you need to start from that level of understanding. It's a way of expressing their feelings, as we had said earlier. For them, particular feelings are attached to particular phrases, and so whenever they want to say, I'm in pain, for instance, I'm in pain, they start saying, I'm sorry. They'll say, I'm sorry, because the last time they noticed somebody was in pain or they felt pain, someone told them, I'm sorry. And for some, they do that because you've asked them a question, they don't know the answer, or they are really trying to understand. Remember, there's usually receptive language and then there's also expressive language. So sometimes some people takes time before, the information loads and they get to understand what is exactly they're saying, and before they figure out exactly what they need to say. So for them to be able to fill in those gaps, they tend to repeat what you've just said, or they repeat whatever phrase comes to their mind. Then the other thing, especially this is very common for delayed echolalia, is they use delayed echolalia to remember things, as you said, to remember situations, to remember feelings, to remember nouns. For example, they were watching a football match and then they saw, maybe I'm just using as an example, they saw Messi kicking a ball. And then next time they want to ask you for a ball, they say, Messi kicked the ball. What they are saying is, I want that ball. I want to go play football. Sometimes they use that for regulation. My son does this. Whenever my son is doing something and it's really working him out, you'll start to hear him vocalizing things. And for some, they actually use echolalia for stimming. I did a video on handling meltdown. You may really want to go and watch it. There are stages of meltdown. Okay. Now, stimming is usually on the agitated phase. So, whenever you see your child all of a sudden becoming echolalic, and if you're not very cognizant for you to be able to act at that time, before you know it, you're going to be handling a meltdown. And the third reason why these children do use echolalia is it's a way of being happy and excited. And sometimes it's also a way of helping them in concentration. Again, I use my son. My son loves to draw. And so most of the time you find him in his corner drawing, he'll be uttering words. He'll be saying words. Okay, sometimes they'll be very loud for you to be able to hear. Sometimes he'll just be mumbling things as he continues to draw. When you see him in this space, you don't really need to stop him. Okay, and sometimes you find these kids are actually in class and they are concentrating, but they are vocalizing. Okay, so instead, of course, that can be a distraction to other people, but trust me, what you need to do, because if you stop him from doing that, you're actually distracting his concentration and sometimes even the whole thought process. So what we tell him is, try to tone him down. And the second stage is teach them scripts. We need to always remember, whenever we are communicating with our children on the spectrum, we need to be very calm, very empathetic. And we always say we teach them scripts because this word was made by neurotypical people for the neurotypicals. You really have to have connected to this child to a point where you know exactly where they are. For some, connection will mean silence. For some, connection will be play. For some, connection will be, doing some activities together. So you need to know this child. How does this child work? What makes this child happy before you start any of these things? So teach them. Whenever you don't know what to say, just say, I don't know. Okay. And how do you teach them? Let them see you conversing with either siblings or other people in the house, and let them see you saying, I don't know. So the other script that you need to teach your child is by prompting them to give correct answer to questions that only have one response, and this response is constant. For example, what is your name? Their name, they will always be, so and so. What's the name of your brother? What's the name of your mother? Where do you live? What's the name of your school? Okay. So you give them answers to those questions. Then the other script that you need to teach them is how to express themselves when they are in need. And I personally feel this is one of the most important ones. Like, for example, I'm hungry, I'm in pain, I need to sleep, I'm tired. And how you do this is by having visual aids. So you see, if you want to go to sleep because they understand going to bed, these are the words you use. For example, they are feeling overwhelmed. For example, somebody shouted at them. For example, somebody called them a name and they know that's inappropriate. They should be able to calm and show you. Again, you use visual aids. Then the third thing that you may use is modeling techniques. And modeling simply means you are training your child. You are actually using the words that you want your child to use. It's like the way you model. Okay. So, for example, for something that you're teaching them to say thank you or no thank you. So if it's thank you, that you have given them something and you want them to say thank you. So you say, Yaron, take an apple. Then they stretch their hand to pick it, and then you say thank you. So you want them to repeat to say thank you. So you want them to request for something. For example, they want something specific. For example, they want to go out to play football, for example. So most of the time they'll tell you, Messi play football, using the example. For example, they are used to seeing Messi playing football, or people usually, Messi scores and everybody's happy. And so they're trying to relate that scenario and them wanting to going to play football. So they'll come to you and say, Messi wants to play football. Okay, but really what they're saying is, I want to go and play football. Okay, so to correct that, you take the ball and say, I want to go play football. Okay, so you hold what they want, and then you want them to finish up the sentence, and then of course repeat. Okay, we try to discourage you from asking questions because chances are they're going to repeat questions, so we prefer you using statements instead. Okay, and when they start in the early process, in the early language development, usually we say, whenever you are teaching them a script or a model, what you need to do is do not attach names towards the end. For example, great job, Yaron. No, just say great job. And when you say great job, either give them a high five or give them a hug, that they're able to relate. Great job is when I've done something good. Okay, or even a thumbs up before you start adding great job Yaron, because once you do early, they'll start thinking great job Yaron is part of the phrase, while Yaron is actually his name. So always remember, echolalia can be part of language development, echolalia can be part of a child communicating, and echolalia can be part of stimming, them regulating themselves. Know the differences, okay? And again, I did a video, you may want to go and watch it on how best you're able to handle meltdowns for our children on the spectrum. Till then, bye bye and God bless you.